This is a CJSN podcast, and I am Tristan de Nattes, MD in nephrology from the Rouen University Hospital and PhD in immunology in the INSERM unit U1234, both in Rouen, in France. I am very happy to present the results of our study named A Simple Molecular Tool for the Assessment of Kidney Transplant Biopsies, which is published this year. Kidney transplantation rejection is a major cause of allograft dysfunction and graft loss. For the diagnosis of rejection, kidney transplant biopsies are required, but their histological assessment suffers from several limitations, such as lack of sensitivity or specificity of some criteria, semi-quantitative scoring, or inter-observer variability. Molecular phenotyping has emerged, providing us with a better understanding of pathophysiological process responsible for rejection. This molecular phenotyping is now recommended by the Banff Consortium, for example, for the diagnosis of antibody-mediated rejection. However, implementation of these molecular tools in clinical practice is still limited, partly due to their cost and the required expertise for data interpretation. Here, we developed a simple molecular assay called RT-MLPA, which enables the simultaneous evaluation of a panel up to 20 genes. This assay can be performed in less than 24 hours on FFPE kidney biopsies and costs less than €20 per sample. Firstly, we identified a 17-gene panel that discriminated biopsies between antibody-mediated rejection, T-cell-mediated rejection, and no rejection controls. Secondly, using a cohort of 220 biopsies, we built a support vector machine classifier to diagnose and classify rejection. In the test cohort, the percentage of correctly classified biopsies was 83%. The highest performance for the classifier was for the diagnosis of antibody-mediated rejection, with 94% of biopsies correctly classified. Percentages of correctly classified control in T-cell-mediated biopsies were 88% and 60% respectively. At last, a subset of 109 biopsies was also assessed using the NanoSwing BHOT panel to compare the two assays. By doing so, normalized gene expression profiles correlated with a R coefficient of 0.68. Moreover, 81% of gene profiles obtained by the two assays were comparable. To conclude, we developed a simple molecular assay based on a restricted gene panel that can be used on FFPE kidney biopsies. In the published version of our study, you will find all the information needed if you want to adopt this assay in your center, including all gene probe sequences used here and an open access website to automatically interpret the assay results. Thank you for listening, and thanks to the CJSN editorial team for publishing our study, as well as referees for the time in evaluating our manuscript. Have a nice day.
This podcast is copyrighted by the American Society of Nephrology. All rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare professional if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast from the American Society of Nephrology.